happens during blood transfusions that are with the incompatible blood, like we were just discussing earlier. Um, Hypochromic anemia is going to be when you don't have enough hemoglobin. Um, so the hemoglobin is actually what colors your blood red to begin with. So if you don't have a lot of hemoglobin, it's not going to be as red um, as other, when it does have the proper amount of hemoglobin in it. So chromic, referring to color, so saying that it's got low color anemia. And then iron deficiency, obviously you don't have enough iron to actually make the hemoglobin, so that's going to be a problem. So they determined about a week ago that I was iron deficient and I had anemia, so they placed me on medications to help me produce iron so that I wouldn't be low anymore. Pernicious anemia is going to be because we don't have enough vitamin B12 in our system. Either you're not taking it in properly or it's not being produced properly. That's actually the stomach's job. A lot of people that have that do gastric bypass, where they take a chunk of your stomach out to make it smaller so you don't eat as much, will develop pernicious anemia because that's where vitamin B12 is produced in the body, and you just took half your gut out, and they'll wind up with that. But that's specifically B12. So we have polycythemia vera. So too many red blood cells produced by the bone marrow. So we had too few, now we have too many. Blood becomes thick, doesn't flow very good again. Too many is not a good thing, especially in this case as well. Sickle cell anemia. So again, your red blood cells are going to be the disc shape, nice and pretty. Looks like a donut, minus that it doesn't go all the way through. The hole doesn't go all the way through. Sickle cell looks exactly like a sickle, or the thing that the Grim Reaper carries around with him. That's a sickle. So they look like that, and they don't carry oxygen very well on that. Those guys tend to get stuck in the blood vessels in different places, and we have what's called a sickle cell crisis, where they just like scrape along the blood vessels and get stuck in different places, and it's very painful. Obviously, your blood cells are carrying oxygen. They're not doing that very well. So overall, this is just a terrible disease. It's a genetic thing. And then we have thalassemia, and that is where you're making hemoglobin, and there's enough hemoglobin there, but the hemoglobin is not functioning properly. So again, there's all these different types of anemias out there. Each of them is different in its own way based on how blood works in our body. So that's all the different ones there. So now we're looking at leukocytes. So we're looking at the white blood cells. So you can have leukemia, pretty common to y'all probably. So this is cancer to white blood cells. It's going to be a result to the bone marrow making weird white blood cells. They're obviously not going to function correctly. So your immune system is affected by this, along with just it being a cancer to begin with. So just like when we had the erythrocytosis and erythropenia, now you have leukocytosis and leukopenia, and that's going to be too many or too few of the white blood cells. Platelets. So thrombo is a platelet. So again, cytosis versus penia, too many, too few. The diagnostic procedures, things we're going to look at in order to diagnose different blood diseases. We have the lab tests that we do. We do a culture and sensitivity. This is where we're going to draw your blood and test to see if there's any sort of bacterial, fungal growth within the blood. If there is, we can then test to see what type of antibiotic or antifungal would work in order to kill that particular disease. So if you wind up with, say, sepsis, and you had microorganisms living in your blood, we can figure out what it is and what can kill it, and then we can help you get better. Complete blood count is routinely done in the hospital, or if you do your once a year doctor's appointments. This is going to look at your red blood cells, your white blood cells, hemoglobin, hematocrit. Remember, we discussed that the white blood cells, there's 5 different kinds. So the cell differential is going to look at all 5 different ones to see if they're high or in normal range, and then they're also going to look at the platelet count as well. We'll discuss what hemoglobin and hematocrit is in just a little bit when looking at the complete blood count, but this is all of it to see if it's normal or not. We have a erythrocyte sedimentation rate. So this determines the rate at which mature blood cells settle out of blood. So again, like I said before, you leave blood sitting around in a tube and it's all going to separate. So this is how quickly that separates and how quickly blood starts kind of grouping together. They give them an anticoagulant because that'll keep it from clotting, but it's able to separate from one another. And this says here that it's an indicator of an inflammatory disease. So we could determine there's some major inflammation going on somewhere because your sedimentation rate is high. So hematocrit is the volume of red blood cells based on the volume of total blood together. So it's looking at it's a ratio of how many red blood cells to all of the different blood cells is hematocrit. Whereas hemoglobin is actually looking at the thing on the red blood cells that actually carries the oxygen, and that's going to tell us how much we have. So the hemoglobin carries the oxygen. Hematocrit is actually looking at the red blood cells. So it's 2 different things there. Platelet count, obviously you're looking at the number of platelets. Prothrombin time. When we looked at the blood cascade last week, 2 weeks ago, whatever that was, that is how the blood clots and all the different things that it has to go through for the blood to clot. So this is just one part of that. So making sure that prothrombin time is correct. You're supposed to clot within so many seconds. If it's longer than that, then you have a problem with clotting, and if it's shorter than that, then you clot too quickly. So this is going to tell us a lot. So if anybody is on medications that's going to prevent them from clotting blood, so again, Sam was saying that that her mother has a problem with not clotting. So prothrombin time is going to show us how much off from normal she is to determine what kind of medication we need to put her on. So if we look at the red blood cell count, obviously we're looking at how many there are. Morphology. So morphology is actually looking at the shape of it. So, you know, they're specifically shaped the way they are in order for them to function properly. So again,